My name is Emily Evis. I'm your physical therapist today. How are you doing?
I'm great. How are you?
Good. I see on your chart you go by Colin, is that correct?
Yes, ma'am.
Awesome. So what brought you in today?
So the other day when it snowed, I was taking my dog for a walk, and I was trying to be careful because I knew it was going to be slippery, but she saw something she liked and tried to take off running, and I had her on a leash, so she kind of yanked me, and I slipped and kind of rolled my ankle, and it hurt a lot. So then I went to the doctors, and they said that it was a sprained ankle, and now I'm here.
Awesome. So it is your right ankle, correct?
Yes, ma'am.
Okay, and then just to get things started, I'm going to be asking you a couple questions just to get a better grasp on your health history and to get a better understanding of your current condition. During this time, these questions are going to help me form goals, and I want you to think of goals as well that can help me make and create an exercise program that's going to help you get back to how you were in the activities that you did before prior to your injury.
Gotcha.
Alrighty, and then as I ask some questions, if I'm not looking at you, it's just because I'm writing down everything that you're saying, whether that's because I have a question later on and need to look back, or if you see another physical therapist, I can just look back on my document.
Sounds
Okay?
good.
So let's get started. So you are 23, correct?
Yes, ma'am.
And then do you work? Do you go to school?
I'm still a student.
Student, and then where do you go to school?
I go to the University of Utah.
So big campus, right?
Yes, ma'am.
Awesome. And then with that said, walking around the campus can be a struggle.
Yeah, pretty much walking in general.
Walking in general.
Yeah.
And then without any activity, like right now as you're sitting, what would you say your pain level's at?
Probably like a 4.
4? And then when you have to walk around campus, does it aggravate it and make it worse?
Yeah, it aggravates it. I'd probably say it's about like a 6 when I'm
6 out of
walking
10.
and moving around, yeah.
And then are there any other limitations that you notice, things that you can't do that you could before you hurt your ankle?
A lot, pretty much anything with walking or like kind of standing. Like I like to ski a lot, and putting in my boot hurts, and kind of flexing it and putting weight on it hurts a little bit.
Okay.
So.
And then it is your right foot, so do you have any trouble with driving? Did anyone drive you here today?
No one drove me here. It does hurt a little bit, but I feel like that little bit of flexing doesn't hurt too bad.
All right.
Not compared to walking.
And then for your ankle sprain, does it hurt more on the outside of your foot or the inside?
I'd say, yeah, it's probably more on the outside.
Outside of your foot. And then have you ever sprained or been treated for that ankle?
No, not this ankle, but my other ankle.
And did you go to physical therapy for it?
Yes, ma'am.
Did you think it helped?
Yeah, it helped a ton.
Alrighty. If there's anything that you thought that helped a lot, like any icing or exercises that you thought really helped, just let me know and we can try and incorporate that into your program, okay?
Okay, sounds good.
Alrighty. Moving on. I just see that you had nasal surgery, but no other problems other than that?
Correct.
Correct. And then for medications, are you currently taking anything?
No, I've just been taking Advil like twice a day to help with the pain and inflammation a little bit.
Okay. And then did you say that you had an x-ray? They confirmed no break?
Yes, we did get an x-ray.
Any MRIs?
No
No
MRIs.
MRIs. Alrighty. And then you talked about walking can hurt. We're going to talk about your living situation. Do you live in a house or apartment that requires lots of steps?
Yes, ma'am. I live in a townhouse that has 3 stories, so
Lots of
lots
walking.
of stairs. Yeah.
And then steps aggravate just like walking.
Correct.
Anything more than the 6 out of 10 that you said, or something like
Probably
that?
not. No.
Alrighty. And then you mentioned that you like skiing and walking your dog. Are there any other hobbies that you enjoy?
I like snowmobiling. Just being outdoors. Anything outdoors. Mostly involve walking or something, so it all hurts.
Yeah, I bet. Where do you like to go skiing?
I like to go to Deer Valley.
Deer Valley, is that nearby for you?
Yes, ma'am.
Nice. And then how often do you normally go skiing, would you say?
About 6 days a week.
6 days a week? And then when ski season's not in season, what do you typically do to stay active?
Gym, hike, bike, walk the dog every day. Depends.
Awesome. So pretty active.
Correct.
So on here I see that your pain sometimes increases at night, is that correct?
Yeah, it's more like in the mornings when I get up, it feels kind of like stiff and achy, sore.
Sores.
Or once I get going, feels a little bit better.
So you injured it 2 weeks ago. Would you say has it improved at all in those last 2 weeks, or just kind of stayed the same?
It's about the same.
Same. And then did you have swelling, bruising at the beginning, and has that gone down or gotten any better?
Yeah, it's gotten a lot better. It's still a tiny bit swollen, but the bruising's mostly gone.
Good. And then you haven't noticed any other bruises on your body that suddenly popped up?
Nope.
No. And then not really night pain, or just a little bit of night pain, you said. But other than that, you've been able to sleep well.
Yeah.
No headaches or abnormal sensations.
No.
Any lightheadedness. Have you experienced any traumas like falling recently or hitting your head?
Nope.
And any changes in your vision?
Don't think so.
Don't think so. You wear contacts?
Yes, ma'am.
And then besides your ankle, I'm just gonna ask you a couple questions just to get rid of some other red flags or anything that might stand out for me. Have you noticed any muscle weakness or any swelling, stiffness, pain in other areas that don't go away? No. And then do you have any problems with coordination or balance? Any
No.
tremors or shaking?
No.
And then no problems with hearing or anything?
No.
Okay. And then any chest pain when you do exercise? Shortness of breath?
Nope.
Coughing or hoarseness?
Nope.
And then for your skin, any new moles or rashes or sores that won't go away?
Not that I'm aware of.
Okay. So based on what you told me, before your injury, you were super active, you like skiing, snowmobiling, walking the dog, that kind of thing.
Yes, ma'am.
You don't really have any significant family history or history yourself besides your nasal surgery.
Correct.
When you don't go skiing, you normally go to the gym to stay active.
Correct.
You've only been taking Advil twice a day to help with your pain. Alrighty, so with all this said, I want to come up with a couple of goals for you. So one thing that seems super important is to get back to skiing, correct?
Yeah.
Alright, so we'll add that to our list. And then something else that I noticed that seems to be important is that you're a student and you need to walk around University of Utah campus, correct?
Yep.
Alright, so we'll put that in here as well. And then one last thing I want to add is I just want you to be able to gain full range of motion in the strength that you had prior to your injury. Does that sound good to you?
That sounds wonderful.
Alright, and then is there anything that I missed or do you think I should know before we keep moving on?
No.
Okay. So with that said, I'm just going to do a couple of tests. With these tests, I'm going to test your range of motion and do some manual muscle tests. With these, I can see like what kind of actions cause more pain than others. It also gives me a grasp of like what kind of exercises I can add to your program and to your home program. If at any point you have excruciating pain, you can totally stop and move on. Does that sound okay with you so far?
Sounds
Alright.
fantastic.
So once I get started, I will have to place my hands on your ankle. Is that alright with you?
Yeah, that's totally fine.
Okay, well let's go get started, okay?
Let's do it.